The design of the IMpassion130 study was a randomized trial of about 900 patients that had either locally advanced breast cancer with no prior therapy or first-line metastatic triple-negative breast cancer. And patients were randomized to either nab-paclitaxel alone or nab-paclitaxel plus atezolizumab. And the primary endpoint of the study was both progression-free survival as well as overall survival. And there were several secondary endpoints, including response rates and quality of life and safety. And the preliminary results, I think, are quite compelling. So first, just in looking at patient characteristics, the majority of patients that were on the study had had prior therapy in the adjuvant setting. So about 63% or so had either neoadjuvant or adjuvant therapy. About half of patients on the study had previously seen taxane-based therapy. And about 90% of the patients on the trial were being treated in the first-line metastatic setting. It is worth noting that about 7% of patients had node-only disease. And the eligibility criteria allowed for any PD-L1 status, but tumor was collected in order to check PD-L1 status using the SP142 assay. And so when they analyzed PD-L1 status on the submitted tumors, about 41% of patients had PD-L1 positivity based on the criteria used in the study for that definition. And the preliminary results, the first report of over a year ago now, were quite compelling. So the progression-free survival in the intention to treat population met statistical significance and had about a 20% improvement in PFS, with an increase from about 18 to 24% at 1 year median progression-free survival. In the PD-L1 positive subset of patients, this is where we really started to see the greatest impact. The improvement in progression-free survival with the addition of atezolizumab was approximately a 40% benefit in progression-free survival. And therefore, the statistical plan allowed to look at the overall survival data. So in the intention to treat population for overall survival, there was a modest difference. Where there was great enthusiasm was in the exploratory look at the PD-L1 positive patients, and overall survival in that particular group had an absolute difference measured in almost really on the updated data, about 7 months in median overall survival. And now there was not a statistical analysis of this. This was an exploratory look, but quite compelling for PD-L1 positive patients with triple-negative breast cancer with the addition of atezolizumab to nab-paclitaxel. These data, when they were presented, was quite practice-changing. It led to the FDA approval of atezolizumab in addition to nab-paclitaxel for patients with PD-L1 positive metastatic triple-negative breast cancer. And I think it has really been adopted widely in practice, where it is quite important to understand the PD-L1 status of patients with triple-negative breast cancer to be able to select appropriate therapy for them. It is important to recall the assay used in IMpassion130 was the Ventana SP142 assay, and the definition of PD-L1 positivity was 1% or greater staining in the immune cells. So keep that in mind as you're thinking about PD-L1 testing in your patients with metastatic triple-negative breast cancer. A question that really remains is what we are to do when our patients have progression of disease on a checkpoint inhibitor. And I think at this point, we really do not have data to support continuation of checkpoint blockade. And so this study really can't answer the question of what to do upon progression of disease. It is a robust area for clinical trials right now, and I would encourage you to look in your community for studies that are exploring combination therapies or checkpoint inhibitors upon progression on a checkpoint inhibitor.